Hi, I'm Carrie Earle. I'm a speech language pathologist and I'm the owner of London Speech and Language Centre. I've been in this field. I've been practicing since 1982 and my clinic works with children and adults with a whole host of different communication disorders. One of them being developmental verbal apraxia, or we'll just call that disorder apraxia. Okay, so apraxia is a serious communication disorder affecting approximately 2% of the population. 70% of those individuals are male, so it's a higher percentage of males and females. And it's an impairment in the ability to produce voluntary speech and to sequence the sounds in words. And it's notable or unique in that it does not, this impairment does not affect non-speech movements like eating and chewing. And so oftentimes children that are affected by this disorder have very poor speech intelligibility, but their understanding of language is perfectly normal. We also know that children that have this problem have more difficulty with longer words, being clear and intelligible as the word length increases, and they sometimes have problems sequencing the words into sentences, so they have expressive grammar problems as well. The best way to describe the problem is to use an analogy, and the analogy is like watching a TV show with an inadequate scrambler. So you've got a TV station and a TV set, and both are working perfectly well, but the message is being scrambled up and you're not able to watch the show for that reason. And that's much like the situation for children that have apraxia. Their speech is fine, their brain function is fine, but the messages from the brain to the organs of speech get all mixed up and confused. So a child's job in treatment is to try to figure out those signals, overlearn the speech patterns, and learn how to become clear in sequencing sounds, starting with a really basic sound production, like just saying the sounds alone, saying sounds in simple little words, and gradually building on that. So it's very much like a problem with a descrambler and a TV set. So some of the things that we look for in children that might have this problem are a case history where there wasn't a whole lot of babbling during infancy, problems with producing consonant sounds like B and D and M and N. We use a lot of the information that we have as speech pathologists on normal language development to guide our thinking. We know that between 3 and 4 years of age, children develop a lot of sounds and are mostly clear by the age of 3, 90% clear to unfamiliar adults. Children with apraxia will have significant difficulty with clarity, will have halting speech, difficulty combining words into sentences, and as I've mentioned, that big discrepancy between their understanding of language, which can be good, and there's significant difficulties with oral expression. It's important to mention that the therapy for children that have apraxia can be longer term. It's not a quick fix. It can be up to 2 years and sometimes longer. We're also looking at intensive intervention 2 to 3 times a week with a lot of parent involvement. So I think the good news is if parents identify the problem early and work with the speech pathologist in the treatment program, children can do very well. And most children with early effective intervention can be oral communicators when they develop into adulthood. So it's a good prognosis. The other thing that might be a good idea for families that do have concerns, in addition to contacting their doctor and getting a referral to a publicly funded agency like the Type Talk program in London, is to always check into your benefits to see if you have any coverage for speech pathology services through your employer or through Extended Health, because it's often the case that there is coverage and that you can augment the services that you're getting through Type Talk or through the school board with privately funded treatment as well. And that's always a good idea.
It wasn't until this past October that we got the official diagnosis that Noah did have apraxia, but previously to that we knew something was wrong. When he was in daycare, the staff there started to become concerned because he wasn't talking, he wasn't interacting with any of the other children. So they approached us to see if we'd be okay with them putting a referral into Type Talk, which is the provincial preschool speech and language program. So we said, yep. We told them to go ahead, put the referral in. So we went there for the assessments, and there they discovered that yes, there was some speech delay, and they put him on the wait list for speech therapy through Type Talk. He received speech therapy, he received about 16 sessions from them. Then he was discharged and went to the school board speech path. And then from the school board speech path, he was then referred on to CCAC, which is Community Care Access Center. And he still sees a speech path through CCAC. And about a year and a half ago, we started taking the private speech therapy up in London. And it wasn't until we started going to the London Speech and Language Center there that they said that this sounds like apraxia. And they went on to tell us that in Canada, a speech path cannot diagnose apraxia. That has come from the medical doctor. So then we had to go to a pediatrician, give her all the information, and wait for her to give us the official diagnosis. We never heard of apraxia before that, so once the speech and language pathologist in London mentioned it, I immediately went onto the computer to research apraxia, what it was, how it could be treated, and such. And I came across a group called the Childhood Apraxia Speech Association of North America, and I got a lot of resources from them and information from that website.
When we first found out that Noah had apraxia, Sonya found out kind of what it was and what we had to deal with. There's a lot of frustrations that come along with it because nobody's really heard about it too much. So we started with sign language, so he would have a form of communication, and there's frustrations with that because everybody has to learn sign language, all the teachers and all the people involved. And we've Sonya's made up a picture communication book, a PECS book, so he could bring that to school. So if he's having problems, he could show the people pictures and point, so they had an idea what he was talking about. And we are going to be receiving a electronic device, which is has pictures that he can point, and it'll help him make the sentences. He can do his homework, his assignments. He should be able to, if he needs help with math, or it'll help him read a book. It'll have everything's programmed. Yeah, Noah, he has to. We learn one word and we practice one word, and then we have to add another word to it. So all the words are common to different places where he's going to be and different atmospheres. So his sentences just kind of flow naturally. And we've done speech therapy to help him out, both at home and we take him to a private speech pathologist, and he sees a speech pathologist at school. But a lot of practice. What are you doing, Noah? He's what?
Can I please have some? What do I get? Yeah.
Hey, Noah, what do you like to go on Tuesday?
Tuesday.
What do you go on? What's on Tuesday?
School.
Huh?
No, I don't know. School is on Tuesday. Right. You want it?
What do you like to look at on Tuesday? What's
Oh.
by A&W?
Gosso. Gosso. You got
Yeah,
today's
the car.
special. No. Not today. What day? What day, Gosso?
Tuesday.
What day this day? Saturday. Enjoy your
Today is Saturday.
as long as we make his therapy fun, he doesn't really get frustrated. Like if you play games, like I got a rack of games over there, play games, get him motivated, he's fine. He doesn't find it frustrating as much. Now, grant you, there are some days where he just doesn't want to do it at home.
Our biggest struggles that we face with Apraxia is finding the help. We have to go through so many appointments. We have to put the time in researching what it is and how to help him. We have to see speech pathologists. We have to just practice. We have to learn what we have to do to be able to help Noah. And Noah, he's pretty good about it. It depends on the child's characteristics, how they act and react. And often he has to repeat himself, and it's like we're playing charades. And so we go through a series of questions. You know, did you do it at school? Is it at home? Is it something you eat? Is it somewhere you've been? Is it and often we go through this just to eliminate different things, and then we can find out what Noah wants or what he needs. And it's just been a challenge, but when any child has a disability, you just have to put the work in it and help them as much as you can, and also encourage them to be able to do it themselves and to try and not give up.
One thing a parent can do is, if they suspect that there's something wrong with the child, is to contact one of the provincial preschool speech and language programs to get an assessment done on their child. And once the assessment's done, the speech and language pathologist will be able to tell you, yes, there is a concern here. We need to put him or her on a waiting list for speech therapy, or they might just say, no, the child's developing just fine. So early intervention with apraxia is essential. Back when we had Noah, I think we had to wait for about 6 to 8 weeks to get off the waiting list for speech therapy.
We recommend you probably see a developmental pediatrician. So after you've been to your pediatrician, they'll often recommend you to a developmental pediatrician, which is we've heard a year to 2 year wait. But and on top of that, we had no idea about this sort of disorder, and we went ahead and bought our own books to find out information. There was we didn't know who to contact. We didn't know what to do about this, or even what should be done at the school. And there's a lot of meetings with the teachers and the principal and the school board to try to get the specific help that you need. We recommend strongly that you get right on it and be active and be there in the schools, because often they don't know either, maybe too much about this. So you have to almost provide all the information to the schools, and maybe even how they can help your child. And it's sort of frustrating in a way, but you want the best for your child, so you put the work in.